and welcome to the Dr. Bob Show. How's your brain doing? How's your mind doing? How's your memory doing? You forget things? You walk into a room, don't know why you went into that room, can't remember the place you were yesterday? Is it normal? Probably is. What can we do to improve our thinking, our cognition? Do you have cognitive problems? Do you have dementia? Do we know what those terms are? Can we prevent those? We'll be answering those questions. My guest is Dr. Monica Crane. Dr. Crane has devoted her life to the treatment of these type illnesses and what we can do to protect you and me. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about why am I always tired? Could it be I've got underlying allergies? Could be. And exercise. Everybody says we need to exercise on a regular basis. What if I don't want to do that? Does that harm my health? We'll talk about it. A lot of information for you. We're talking with Dr. Monica Crane, board certified in geriatrics, and spends most of her time talking about dementia and teaching patients and what we can do to help them prevent, improve, and make their life better. Monica, welcome to the Dr. Bob Show.
Oh, thank you for having me back, Dr. Overhaul.
You're such a great guest, and it's always so much fun having you. Let's go back and talk about what is dementia. What does dementia mean?
The word dementia is actually not a diagnosis. It's a broad clinical term. Think of it like an umbrella, and under it there are about 100 subtypes. It implies that you have a neurodegenerative disease, meaning degenerative of the brain, that's progressive and affects day-to-day function.
So it's going to progress and get worse and worse and worse in general.
Yes.
Are there different types of dementia?
There are about 100 subtypes. We see likely the top 10 in clinical practice.
What's the most common cause of dementia?
The most common subtype is Alzheimer's disease.
So everybody's heard of Alzheimer's disease, but what is it and what's it like and what's going on in the brain?
Well, Alzheimer's disease is unique in that it starts to affect short-term memory, then visual spatial function. It really targets the temporal and parietal lobes of the brain. That's the area above your ear and the area towards the back of the brain. It also is quite progressive. There are many subtypes of Alzheimer's, such as early onset, late onset, and then different variants within that.
Is it easy for somebody to pick out if somebody in the family, a loved one, a spouse, an uncle, a family member, a member of the church, can you sort of tell when somebody's getting dementia?
Well, I think families are pretty good at recognizing changes in function. They know their loved one the best, and they see changes that maybe the doctor doesn't see.
Yeah, so we rely on family members to help bring in the patient for the diagnosis.
Correct.
What's going on in the brain in Alzheimer's?
With Alzheimer's disease, it really affects day-to-day function. There are great treatments, but Alzheimer's can cause plaque and tangles. We think that that's pathology. We don't even know the cause. We think there might be an inflammatory process that's underlying it, but there are so many other dementias that are quite common that we hope to focus on.
When you say plaque and tangles, what do you mean by tangles?
So tangles in particular are clusters or clumps of something called the tau protein. And it's a unique folding pattern in Alzheimer's, which is different than some of the other dementias that also have misfolded tau. So these are just all different diseases with misfolded clumps of protein.
And they manifest themselves by people changing their personality, changing their activity, their thinking, their cognitive ability. Is that what happens?
That can occur, especially with changes in thinking and changes in personality and mood. That occurs a little later in Alzheimer's disease, but there are some dementias where it occurs earlier.
Now, I wanted to talk this evening on Lewy body dementia. I did not realize how common it was. What is Lewy body dementia? How common is it in the United States?
We think about 1 million people are affected with Lewy body dementia. What's more confusing is we think that it's an umbrella term. Lewy body diseases, an umbrella term for both Lewy body dementia as well as Parkinson's disease with dementia. But what's unique about Lewy body dementia is that in addition to the dementia symptoms, so you have to have symptoms such as changes in your thinking, difficulties with visual spatial problems, you may or may not have short-term memory deficits.
So what is characteristic about Lewy bodies? Is there a certain, how can you tell the difference between Alzheimer's and Lewy body dementia? What do you see that makes you say, I wonder if this is not Lewy body dementia?
Well, there's one key thing, and that is fluctuations in attention and concentration. And you might say, what does that mean? It means that someone might have a good day one day and then a really bad day the next, or even changes in mood and behavior and thinking within the day. Alzheimer's disease, typically, folks are doing really well throughout the day and maybe have some evening confusions, but you don't have these rapid up and downs.
So that might make people miss the disease. If there's ups and downs, they look forward to the good and pass over the bad.
I think sometimes when loved ones, especially a spouse, sees the good day, they think that maybe perhaps they're seeing too much on the bad days. But other really big clues is that you can have a Parkinsonism, and what that means is that you have things that are similar to Parkinson's disease, like a tremor, but not always. You have changes in gait. Individuals tend to have a shuffling gait.
Just sort of walk in a shuffle. Do they fall easily?
Yes, increased falls, and so that also can distinguish Lewy body disease from other dementias, is that there tends to be early falls.
Muscle rigidity?
Yes, their muscles can be very stiff, so many times instead of having tremors, you have these other changes with what we call axial rigidity, a fancy way of saying your trunk is very stiff when you're walking.
But so you begin to pick up these things when you see somebody walk and talk, and when you interview them, you can begin to organize your thinking about what type of dementia is going on?
Yes, but I think there's another key feature that we look for in Lewy body disease, and that is visual hallucinations. It's pretty unique to Lewy body disease. It can occur in other dementias, but it occurs early. Sometimes you see something that's not there. Earlier on, sometimes you have a misperception, like you saw something out of the corner of your eye, so it's not quite clear that you had an overt hallucination.
Do they act out their hallucinations where they see things? Do they sometimes, I know I saw that person, or I know I saw that whatever it was?
Yes, individuals can also have delusions or psychoses, like a belief that they saw something. We also see changes in sleep, so sometimes nightmares become lifelike.
Is there something you can do about that? Are there medications to help hallucinations, or to help the Parkinson-like activity, or does sometimes the treatment for one hurts the other?
Well, it's very tricky. The first-line treatment for all of the symptoms is usually cholinesterase inhibitors, a fancy way of saying memory medicines that increase acetylcholine. So there's one medication that's actually indicated called rivastigmine, so we do recommend that. And that can sometimes help with things like the problems with mood and behavior as well as thinking. But in terms of the movement symptoms, we can sometimes try typical Parkinson's drugs like carbidopa-levodopa.
So how do you know which one you can use and you can't use? Is it through trial and error, or?
It's trial and error. Every patient is unique. We actually think that these are a spectrum of disorders, meaning it's not just a box that you check. Likely some people have more movement and less cognitive symptoms. Some people have a lot of cognitive symptoms and little movement. So we really focus on the symptom that's most troublesome. So for instance, if a family says, my loved one is hallucinating day and night, it's causing grief, it's causing a lot of stress, we should focus on treating that first rather than treat the movement symptoms.
So you're beginning to, that umbrella that you're talking about, every patient is different in their type of dementia and their treatment and your approach to those. Are there other types of dementia?
Yes, within this same family, so talking about this umbrella of Lewy body disease, there's another dementia subtype called Parkinson's disease with dementia.
So Parkinson's disease with dementia, and that's what we're going to be talking about when we come back. This is an umbrella of illnesses, and it takes a real specialist to know exactly what street that person is walking down so that we'll know the right medications for them. A lot of information. You're going to want to stay tuned. We're talking with Dr. Monica Crane, board certified in geriatrics, specializing in dementias like Alzheimer's and Lewy body dementia. There's over 100 subtypes of dementia. They're progressive neurologic disorders. The part that I thought was interesting in Lewy body dementias are it can come and go, where you're having a good day and then a bad day, even within the same day, that there are hallucinations that are very, very, very active in some of these patients. And they have muscle rigidity and stiffness and problems with gait, similar to Parkinson's disease. So, Monica, teach me about Parkinson's and Parkinson's with Lewy body. What's the main difference?
So Parkinson's disease with dementia is what happens after someone has had Parkinson's disease for a while. So usually an individual has had ongoing therapies, and after about 15 years, it's very common to have mild impairment or even the overt dementia syndrome. The main difference is that you're on Parkinson's disease dementia drugs, you have prominent gait changes, and then the memory comes much later. So the problems with thinking occur much later in the disease.
So let's go to some other types of dementia. When we talk about Alzheimer's dementia, when we talk about Lewy body dementia, what are some of the other types? The ones that come to my mind are vascular and frontotemporal. What does that mean? How do those differ?
So frontal temporal dementia affects the frontal lobe, and the temporal lobe. So the part right behind your forehead and again over your ear. And that can affect mood and behavior and executive function, so making decisions and judgment and insight early on. The problem is there's overlap. It also affects the temporal lobe, so you can have short-term memory problems similar to Alzheimer's disease.
Is it easy to differentiate if somebody's got Alzheimer's or frontotemporal dementia?
Well, I used to think it was a lot easier. We now know that there's an overlap of pathologies. Now, we don't like to talk about autopsies, we want to talk about people, but on autopsy, a lot of times we see an overlap of pathologies, like someone who has Lewy body pathology, which is this clump of a protein called alpha-synuclein, as well as the Alzheimer's pathology.
So there are different proteins that cause the neural pathways to get messed up.
We think that that might be the scar tissue. We don't know. It could be a chronic inflammatory process, so that's why your ideas and your goals on prevention and exercise and diet are so important.
And we'll talk about exercise and diet in just a little bit, and I think that feeds in with vascular dementia. Is vascular dementia just where the blood vessels aren't behaving properly because we haven't taken good care of them?
Yes, so vascular dementia is two subtypes. You can have multi-infarct, which means multiple strokes. We don't see that as much because we do a pretty good job of treating strokes and preventing strokes. Instead, we see microvascular disease or ischemic disease. Sometimes people say, I was told that I have white stuff on my MRI, and it's white matter disease. It's disease of the wires in the deep parts of the brain. It's a scarring that occurs if you've had chronic high blood pressure, high cholesterol.
So when you have this vascular type dementia, can you see that on x-ray? Do you see the little strokes? Do you know somebody's having multiple? And when you say multiple, do you mean 100 or 50 or what's going on in the brain?
Well, to have a diagnosis of vascular dementia, you still have to have a change in function and you have to degenerate. So you can't just be stable. Sometimes people have one stroke and are perfectly stable. That's not vascular dementia. Vascular dementia is progressive. We tend to see a combination of a small ischemic stroke, that's the actual true stroke, as well as these other little spots deep in the brain, which aren't actually mini strokes. They're just little scars that occur at a very microscopic level.
You and I were talking earlier about a study that's going on some new medicines that will help people with dementia. Teach me about that again.
Well, we're wrapping up a study for Alzheimer's disease that actually works at the level of the mitochondria. So again, it gets us this idea that there's something with the energy that we're taking in and inflammatory processes that are occurring. So we're finishing that project up in conjunction with Harvard. We're also doing 2 other studies looking at agitation medications, because one of the biggest problems and the life-limiting problem of the dementias are behavioral disturbances. Those are the ones that cause the most distress, even more than having memory problems.
So people will suddenly lose it, get angry, bursts of anger, throw dishes. What are we talking about?
Well, we can see all of the above. The typical problem is a change in someone's baseline personality. Someone who has always been level-headed is now developing a short fuse, getting very angry, maybe yelling, screaming, seeing things that are not there, like we talked about the visual hallucinations. So there is a drug that's currently approved for Parkinson's disease and Lewy body dementia with hallucinations and psychosis. We're hoping that that drug is expanded to cover other dementia types.
So it sounds like we're getting more and more sophisticated in understanding the overlapping of the different dementias, the different types of dementias, the ability to be able to treat some of the different things that we see with the different types of dementia. Is that correct?
I think eventually we'll treat patients like an N of 1. What I mean by that is we'll treat them as if you're the only person with this disease. We'll look at the specifics of that person as overlapping circles. So think about someone may have more of one symptom than the other, but it's not as clean cut as we thought.
You know, to me that excites me, because the things that it's exciting is that every patient is an individual. You can't lump somebody into Alzheimer's. You can't lump somebody into Lewy body dementia, to vascular dementia. It's something that a little bit of one hooks onto the other and makes the treatment more specialized, where everybody knows that there may be a treatment that really brings them out of it, makes them perform better. What can family members look forward to in treating these dementias?
Well, aside from medication, so our job is to prescribe the appropriate drugs, but there are the non-drug interventions. Having a great schedule, having good sleep hygiene, exercise, having a really good whole food diet is so critical to improving the disease.
So if somebody's got the disease, those things can help. Can they help prevent, we've got about another minute here. What about exercise and eating properly as far as preventing dementia? Do we feel like there's a place for that?
There's great evidence that prevention is real for the dementias, and the critical portions of treatment include exercise and dietary changes.
And sleeping and laughter and socialization. It's the things that we try and teach people all of the time in order to have better health. You know, you've got to exercise, you've got to laugh a lot, you've got to eat properly, and you've got to have proper sleep. And all those things end up telling their tale later on in life, don't they?
It's never too late to start. I always tell my patients. So even if someone comes into the office and is 80 years of age, it is never too late to quit drinking too much, drinking lots of soda, eating fast food products. It's still not too late. So I think there's no age limit on prevention.
Monica Crane, I love talking with you because it's your excitement for taking care of these patients that may be difficult in our society, but to know that there's so much that we can do. And in the future, hopefully sometimes we'll get rid of these dementias.
I do believe we'll have disease-modifying treatments, but it's going to be more like the cancers, where it's multiple drugs, multiple interventions, not just one magic pill.
Your excitement excites me. Great information. Know that if you've got dementia or a loved one has dementia, that there's treatment and there's guidance that's needed, and you can improve. It's a progressive problems, but we're learning more and more and getting better and better. So know that there's always that hope and that ability to improve. Now you're going to want to stay tuned. We'll be talking about why am I tired all the time, and do I really have to exercise to stay healthy? Well, we do to prevent dementia. Well, how about heart disease and other problems? You'll want to stay tuned. I want to thank Dr. Monica Crane. Wonderful discussion on dementias and the changes in treatment and the caretaking for dementia improving every single day. Know that there's lots of improvement in the future. Now, questions from you, the viewer, that I think will be important to your health. Question number 1. Dr. Bob, I'm tired all the time and my doctor says all of my blood work is normal. What could be the problem? Well, what I want to lead into is one of the common causes of people not feeling good, people feeling tired, are allergies. People that have simple allergies, simple nasal allergies, somebody that has stuffy nose and sniffles and sneezing, symptoms that are not incapacitating them in their life can cause severe brain fog. People just feel tired. They can't think well. They don't act well. Why could that be? Well, let's look at the allergic reaction that occurs in the nose. When we've got people that breathe in pollen, there's an allergy reaction that releases chemicals, and those chemicals cause people to be tired, to be fatigued. Let's look at nasal symptoms. People that have stuffy nose and congestion. They don't sleep well. It's a frequent cause of snoring that people have. When they don't sleep well, they don't perform well. People can get secondary sinus infections and ear infections. And when they have those infections, they don't feel well. What can a person do if allergies are making them have brain fog? Well, number 1, you have to see an allergist who can identify what you're allergic to. Then there are certain things you can do to avoid dust or to stay inside at times of the year where pollen is a problem, or maybe changing the environment if it's animal dander that's bothering you. There are also wonderful medicines that we can take that will improve your health and make you feel better. And then there are allergy injections that will build up your immunity to help get rid of the allergy where you may not even need medications. So know that if you've got brain fog, if you're tired all the time, it indeed could be due to allergies. Question number 2. Dr. Bob, I hate to exercise. I think that's so cute. How important is exercise? Well, let's talk about it. You know, exercise is probably one of the most important things that we can do. We know that exercise helps us keep our weight proper. It helps us keep our weight at the level that we want. It makes it where people's insulin is used better. So when they eat food, the food is metabolized better by insulin because of exercise that does that. Exercise does stimulate certain areas of the brain that make people feel happier. They actually feel better if they're exercising regular. We know that people that exercise regular will get better sleep pattern. And sleep is one of the things that we want to be sure that we do if we want to stay healthy. So exercise, yeah, it really, really, really is important. It also helps lower your blood pressure. It causes new blood vessels to occur in the heart and even in the brain. There's neogenesis, big long words. It just means that there's better blood supply that's developed if we exercise more. Talking about dementias, if we want to prevent dementias, exercise is part of the treatment. So we need to be sure that exercise is part of what we do every single day. So get in that habit, find where your tennis shoes are, open that door, get outside, start walking. If you can walk an exercise with somebody else, it makes it a lot more fun. And you can talk as you walk and as you exercise. The more pain, the more gain may be correct, but just being sure that we exercise on a regular basis. All the time that we have for this show. Remember those 4 things that we talk about every day. Number 1, exercise. Exercise will improve your health, so get in a regular habit of doing that. See if it doesn't make you feel better. See if you don't really look forward to that next day of exercise. Be sure that you're getting 7.5 hours sleep. Sleep is very, very important. If you're not sleeping well, think about the reasons. Is it medications? Is it the noise in the room? Is it you don't prepare yourself for sleep? Are you waking up because of pain or because of going to the bathroom and you can't get back to sleep? If you're having trouble, talk it over with your doctor. Eat properly, fuel the engine. And so eat more fruit and fiber. Stay away from the red meats and fried fatty foods. And eat good food, fruits and vegetables. The more of those you eat, the better you're going to be. And most of all, what is it we like? It's that laughter in your life. If you laugh a lot, if you find somebody that you giggle with a lot, you're going to stay healthier and the world will be healthier around you.